Okay, we are recording.
Great, okay. I'd like to call the regular meeting of the 708 Mental Health Board to order. Bob, would you like to read the notice?
Yes. This message is being read on behalf of Dundee Township Supervisor Patricia Trish Glees. This meeting of the Dundee Township 708 Mental Health Board will be held via a video audio conference call in accordance with the Illinois Governor's executive orders and disaster declarations regarding the COVID-19 pandemic. Senate Bill 2135, signed into law by Governor Pritzker, addresses electronic meetings during time periods when the governor of the state of Illinois has issued a disaster declaration, like the situation we are in now. Pursuant to this new law, this Dundee Township 708 Mental Health Board meeting will be conducted by audio or video conference without a physically present quorum of the Dundee Township 708 Mental Health Board because of a disaster declaration related to COVID-19 and public health concerns affecting the township. Pursuant to the new law, Dundee Township Supervisor Patricia Trish Glees has determined that an in-person meeting at the township building with participants is not practical or prudent because of the disaster. Township officials, legal counsel, appointed board members, and the township administrator will not be physically present at the township building due to the disaster. This meeting is being video recorded and will be made available to the public via the Dundee Township website as provided by law, and all votes will be done via roll call. The general public had the opportunity to receive access to this meeting by requesting via email or telephone call by October 7th at 5 p.m. to the Dundee Township Supervisor, Trish Glees, at info@dundeetownship.org or 847-428-8092, extension 1.
Thank you, Bob.
You're welcome.
For those of you who don't know Bob, this is Bob Block. He's the office manager for the
Correct.
Dundee Township and the assistant clerk,
Correct.
right?
Deputy clerk, yeah.
Deputy clerk, excuse me.
That's okay.
So I'd like to thank Bob for filling in for Trish tonight for all the formalities and for running the Zoom call. So thanks, Bob.
You're welcome.
Maria, would you like to take the roll call, please?
Yes, we're taking attendance. Trustee Don Arimura.
Present.
Trustee Maria Borrero, present. Supervisor Trish Glees, she's excused. I guess.
Excused.
Trustee Alec Neuschaefer.
Present.
Trustee Cindy Oldin.
Here.
Trustee Paul Setze.
Here.
Trustee Wendy Witt.
Here.
So we have 6 present and 1 excused. Should we add Bob to our list of
No.
attendees? No?
Not for a roll call, no. We
Okay.
make a note that Bob was
Okay.
in attendance and responsible for the legal notice as well as for controlling the recording.
Sounds good. I'm adding that right now.
Okay. Okay, next item on the agenda is to approve or amend the agenda as presented. Can I have a motion for that, please? Anybody?
So move.
Thanks, Don. A second, please.
I move. I second.
Thank you, Alec. Is there any discussion? Okay, I just have one thing to say about the agenda. Chris Reed, who is scheduled to speak after we approve the agenda, let me know that he would be unable to join us until 7 o'clock this evening. So we agreed that we would proceed with our meeting, and then when he joined, we would interrupt whatever discussion we were having at that point and allow Chris to speak. He just texted me saying that he was not going to come in on Zoom, but He was just going to call in, and I said that was fine. So that's the only change in the agenda, is just the order of where the guest speaker comes in. So is there any other discussion? Okay, hearing none. Maria, would you take a roll call to approve the agenda?
Yes. All right, we're approving the agenda. Trustee Don Arimura,
Yes.
Trustee Maria Borrero, yes. Supervisor Trish, please. Trustee Alec Neuschaefer,
Yes.
Trustee Cindy Oldin,
Yes.
Trustee Paul Setze,
Yes.
Trustee Wendy Witt.
Yes.
Okay, we have 6 yes and
No nays.
no nays.
Okay, the agenda is approved. Great, thanks, Maria. We'll skip over the guest speaker until he joins us, as we agreed. And the next item on the agenda is a motion to dispense with reading the minutes for September, and I should have made this a correction to the agenda. It was for the September 24th, 2020, 708 Mental Health Board regular meeting, and amend or approved as presented. Could I have a motion, please?
I move.
Thanks, Maria. Second?
I second.
Thanks, Alec.
Sorry.
No, that's perfect. Thank you. Is there any discussion?
No.
Okay, I just lost my copy of the minutes. Oh, here they are. Sorry. I just had a couple of nitpicky changes to the agenda, and I can just be brief. If you don't have them in front of you, I'll just briefly describe what they are. There's right at the beginning, it says Chairperson Paul Setze called the meeting order. It's missing a to order. And that Supervisor Trish Glees to take meeting minutes. The minutes is missing in the sentence. So that we'll need to add that. And then Alec's last name, there's a typo.
Oh, well, to be fair, I mean,
So
it's,
we'll get that corrected. And then under old business, change have to having issues.
I'm sorry, but could I possibly inquire as to how my last name was spelled?
Instead of an F, there's a G. Which is simply
I'm sorry.
clearly a typo. I mean, no.
I know. I just always find it funny.
Yeah.
Continue. Sorry for the tangent.
No, that's all right. Under status of interviews and under Cindy Olin, it says many states. It should be many state. And then those interviewed are interested in in parents living trust and community service work, I think was what you had said, Cindy. And then
Isn't there something to, did she say patients instead of parents?
let's see.
I don't have it in front of me either.
Paul, would you like me to make an annotation to have corrections done to these documents? And who will be doing that? Because I didn't take the notes, but that week, but I could make them if needed.
Now, Trish, what I propose to do is, I think this was a Word document, if I remember right. I can make the changes and track changes and send it back to Trish. I'm running through, so we have documentation on the video of what the changes are.
Definitely, yeah. I just wanted to make sure I put it at least that we're just explaining the corrections.
Yeah, and they're basically just typos or missing words. I'm sorry, Cindy, your question again?
I just thought maybe she said patients instead of parents.
Yeah, she actually said 8 patents.
Oh, okay.
Yeah, I missed that one. So it was 8 parents, right?
Okay.
That's the only one I caught.
Okay, no, that's fine. I always tell people I'm a better editor than I am a writer. And then under Chairperson Setze and Trustee Arimura, that really the last full paragraph. The last sentence, it says brought into, where it should be into, should be 2 separate words, not a single word. So those were the changes. I mean, they're minor, but I think it's important that we have correct English in our documents, since they're public documents. So if no one else has any other changes or suggestions or amendments to the minutes, Maria, would you take a roll call to approve the minutes?
We need a motion or, no,
Oh,
we
I'm
make.
sorry.
a motion.
We
Okay,
have a motion.
I
But
motion.
but it should say minutes as corrected,
Okay,
because the
This is the
motion
roll-
said approve the minutes.
yeah, so
Yeah,
we're
the
going
minutes
to
as correct.
approve the minutes as corrected. Trustee Don Arimura,
yes.
Trustee Maria Borrero, yes. Supervisor Trish Glees, Trustee Alec Neuschaefer,
Yeah.
Trustee Cindy Oldin,
Yes.
Trustee Paul Setze,
Yes.
Trustee Wendy Witt. We have 6 yes, 0 nays.
Okay, the motion carries. Thank you, Maria. Bob, I understand there's no one from the public. Is that correct?
That's correct. No one requested login codes, so I don't anticipate that anybody would be coming.
Okay, then we'll skip over the public comments. There being none. So now we're on to old business. Issues with SharePoint. Some of you, I think, are still having issues. Cindy, you can't see files that we put up, that I put up there, at least, correct?
Well, no, I ended up putting Bloomingdale in the search, and then they came up like by themselves.
Oh,
So I
okay.
did find them
Oh, great.
like 2 seconds after I emailed you, and I thought I emailed you that I found them, but
Okay.
but you said you were not able to see my stuff, and Trish told me that she was able to see it.
Yeah, I still can't see anything that you've uploaded. And I know one of those is your summary of your conversations with parents.
Correct.
So what I'd like you to do until we get that straightened out, could you just send me that file? Attach it to
I'll
an
get
email
someone
and
to
send it
help
to
me.
me. I'm sorry?
I'll get someone to help me.
Okay. Okay. Because I'm trying to collate all the discussions to, to identify themes and stuff so we can use that to frame future conversations.
When is Trish supposed to get back?
Not
She's
sure
going
when
back to
she'll,
work?
I mean, she's resting now. And the surgery was successful. Bob told me before everybody else jumped on that she's pretty tired right now and recovering. If I remember right, Bob, you might be able to correct me, but I think she said that she has to be in quarantine for a couple of weeks, but she can still work remotely. But, depending on how she responds to the surgery and the post-operative care and the medications and stuff, I think is really the what we have to wait for. They really can't, totally predict all of that.
Okay.
Yes, I'd say that's correct.
Okay.
Mr. Reed has joined the meeting, so I will let him
Oh,
in.
great. Yeah, please do, Bob.
Hello, Mr. Reed.
Hello, how are you?
I'm good.
Hi,
Can you hear-
Chris. Yeah, go ahead, Bob. I'm sorry.
I was just going to say, can you hear him, Paul?
I can hear him. Good
Great.
evening. Good evening, Chris. This is Paul Setze.
Hey, Paul.
And I want to thank you for taking time out this evening to talk to us. Because you're on the phone, let me just tell you who's on the call.
Sure.
We have 6 of the 7 board members. Supervisor Trish Glees, the supervisor for Dundee Township, recently had surgery and was unable to join us tonight. But the other 5 trustees, in addition to me, are in attendance. And they are Dawn Arimura, Maria Borrero, Alec Neuschaefer, Cindy Oldin, and Wendy Witt. We're on the Zoom video portion of this call. So I'd like, at this point, you came in at a perfect point, Chris, because we just finished, well, we were discussing some other minor issues with our technology stuff, but we can return to that after you talk to us.
Sure.
So at this point, I'd like to introduce Chris Reed. He is from Northern Illinois Recovery. And Chris, I will turn it over to you. And if you want to add on to that introduction, please feel free to do so. But what we're most interested on is, we're trying to get started here, trying to understand, what other organizations have done in working with 708 mental health boards, and anything else that you might feel is relevant to what we're trying to do here.
Sure. Well, first, can you guys hear me okay?
Yes,
Yes.
Okay, great.
Yeah.
quite clearly.
Well, thank you for the invitation. I really appreciate just like the opportunity to be able to tell you my experience and what we've been able to do with 708 funds and, how that's changed and been able to place us in a position responsibly to bring like much needed programming to the McHenry County area. The how much time do we have? I could talk about this specific topic for a while. I don't want to go over.
Maybe 15, 20 minutes.
Sure. Okay.
Is that good timing?
Yeah, of course. So I'll just give you a little bit more background. So I have 2 organizations. One is a 501c3 nonprofit, which is called New Directions Addiction Recovery Services. And that is the only organization that I have 708 funding with in McHenry County right now. Northern Illinois Recovery is on the for-profit side. But 2 separate organizations. We do not actually take 708 funding at Northern Illinois Recovery, but I'll give you a little background on both of them. My personal story is that I've been in recovery from substance use disorders since September of 2009. And I was, a part of the opiate epidemic and was fortunate enough to get sober in the Crystal Lake area in 2009. And have remained, in that spot since. Some of the how the organization started was really I had just operated another business, and we had rented some commercial space in Crystal Lake, and me and some other people that I was in recovery with started using that space as a hangout, which ultimately turned into what we call now as the sober bar, which is called The Other Side. And we operated that as a community organization under the umbrella of New Directions for about 5 years. And we started pursuing other opportunities in the community to fill some other gaps within the substance use disorder world, specifically housing. We were really fortunate, and we were hooked up with a family that helped us purchase 2 homes in McHenry in Crystal Lake, which we were able to convert into group homes, sober living homes, is technically what they're called. And So we have, in 2016 and 2017, we opened a male and a female sober living home. And that is when our relationship in 2016 with the 708 board started. We were continuing to run the bar, and we had just opened these 2 homes that were serving about 19 people in Crystal Lake. And we had put in a application to the 708 board to start delivering some services. So we got a purchase of position grant to hire on 2 case managers, which allowed us to start providing some direct service to people in the homes. So our goal was to help them with things like getting a driver's license, opening up a bank account, removing pretty much the barriers in life that would prevent somebody from participating in long-term recovery. And that's what started the relationship. So we received case management funding in year 1 and in year 2 in 2017. In 2018, we pursued a 3rd home and a capital grant from the 708 board in McHenry County, which we received, and they funded the purchase of our 3rd home, which we opened in 2018, and it was another men's home, and continued our case management funding a little bit. We started to decrease that as the organization was generating more revenue on its own. So our recurring requests from the mental health board that we received started to kind of go down as we built up our organization from a revenue and self-sustaining standpoint, because all of the programming and models that we had created were generating revenue on their own and at some point would be self-sufficient. So that was part of our whole plan from the beginning. I'll fast forward to this year. I think one of the most impactful things that the 708 board and McHenry County has done in the last probably decade, but we partnered up with Pioneer Center. I don't know if anybody's familiar with the Pioneer Center, but they ran the McHenry County Pad Shelter out of Woodstock, which was the homeless shelter that served anywhere between 40 and 50 homeless a year. And they had raised some money on their own. And at New Directions, we had raised some money to open up a recovery retreat campus, which would serve the uninsured or underinsured people in McHenry County. And at the same time, Pioneer Center was fundraising to open up a new facility in McHenry that would be a year-round shelter and house 80 to 90 homeless year-round, which was essentially doubling their capacity. And the 708 board wrote a collaborative grant in 2019 with New Directions and Pioneer Center and funded a project of $675,000, which allowed us to purchase the old property of the homeless shelter. So we acquired the old homeless shelter, and we used the money that we had fundraised to help with the first year operating expenses and any of the capital improvements that we needed to do. And since they owned the building free and clear, the $675,000 that we purchased the building for is what Pioneer Center needed to complete their renovation at the new building that they owned. So in kind of one sweeping motion, we built a 35-bed sober living facility that was going to be a 4-month program. And it's a peer-to-peer program staffed by case managers and recovery coaches. And at the same time was able to help with the financing of a brand new homeless shelter in McHenry County. And that adds an additional 50 beds of homeless capacity in McHenry County. And up to this date, we still have an ongoing relationship with the 708 board, which has been very valuable to us. And I know a lot of other organizations have had great experiences with the 708 board. And I think what we have done really well is we've taken funding from the tax levy, but we are not reliant upon the funding from the tax levy. So if the 708 board was to say, hey, listen, we're just not going to fund you guys this year, we would not shut down, right? We wouldn't grow as quickly, and we wouldn't serve the need in the community and be able to meet those needs and expand and create access as quickly as we would like to. But we would not crumble underneath just because we lost any 708 funding. And I don't think that is always the case with some organizations. And some programs are entirely built upon the funds that they're receiving from the mental health board. And I think that there's a push to get away from doing that and create models that are self-supporting and self-sufficient, and then occasionally fill a gap here and there that absolutely needs to be funded. But that is, I think, that's been my experience. And we've done, McHenry County also does a really great job of auditing, 4 times a year and making sure that the money that's being allocated is being allocated in the right spot, and it's being done responsibly, and that outcomes are being reported, and that people are held accountable to those outcomes. So I think I'll just wrap up with saying, that's, New Directions has the sober bar. We've got 3 sober living houses now in McHenry County that we own outright and are deliver like a really quality service to the recovery community. And in November, we'll be opening up this 35-bed sober living facility in Woodstock that will double our housing capacity. And I think the last thing that we do in partnership with the 708 board is we have a crisis response team with recovery coaches, and we monitor the Way Out program in McHenry County, which is where somebody can walk into the police station and ask for, help for addiction or alcoholism or whatever their need is. And the police will facilitate them to Northwestern Hospital, at where Northwestern will loop us in, and we will deploy a peer certified recovery coach to help them navigate whatever services they might need, whether it's detox or treatment, and so on and so forth. And then we do follow up with that person for 3 to 6 months in order to make sure that they're getting the help that they need. But yeah, I feel like I may have rambled on for long enough. I would regret not mentioning, so me personally, I've always done all that work with New Directions. Just as the president of the board, I've never worked for the organization. We just, we have a executive director we recently hired and a full staff of case managers and recovery coaches. But I opened a partial hospitalization and intensive outpatient program in Crystal Lake, which is called Northern Illinois Recovery. And we grew relatively quickly, and we now have one of the larger outpatients in the Chicagoland area. It's a great program, and we're looking at expanding and adding, detox and residential levels of care in the next 6 months. And I mentioned that just because, I think it paints a good picture of, what we've been able to do in the past 5 years with, some help from the community and, leveraging community dollars to create a recovery community and an environment that would support other types of recovery. And it's been going very well. And if you have any questions, I would be happy to answer those now.
Oh, hi. I was very impressed by your quote unquote rambling. I would like to, as someone who, ironically enough, as soon as they turned 21, decided to completely stop drinking. I'm 23 now. I would like to inquire more as to what you are talking about when you mean sober bars?
Sure. So we operated, the sober bar that we operate is really just like a social environment for people, not only for people in recovery, but people who just start choosing not to drink, which sounds like yourself. And we were in a location in Crystal Lake for about 9 years. We recently received a grant to move that. So we're in the process of, we already moved to a building in downtown Crystal Lake that is basically, we're going to change the model a little bit, but it's going to be a coffee bar and bar. So everything you would picture a bar would be is what this will replicate, just with no alcohol. And we do other things there, like family support groups. So we've got, family Al-Anon meetings there. We've got 12-step recovery meetings there that happen several times a week. And they're pretty well attended. Prior to COVID-19, an average meeting size was between 60 and 100 people there. So it's pretty successful in that regards. And then like Thursday through Sunday night, it's really just kind of like a social place to either watch a game or meet up with some people or play pool or whatever that would look like. But yeah, that is kind of what that looks. That's
Okay, cool. Very interesting.
Chris, this is Paul. Couple of questions. First one is, did you have issues with community resistance to setting up physical locations? Like you mentioned, the purchasing of buildings and things like that for the types of programs that they were going to house?
yeah.
The signal is breaking up.
It's a long story. Can you hear me now?
Yes.
It's a long story, but yes, there was a lot of resistance in regards to the sober living homes that we opened.
Mhm.
And how that relates to the 708 board is they really took a position that this was a service that was required, and lives were at stake if it was not to be done. And I think the proof now is 2 years later. I don't know if you're familiar with overdose rates in the collar counties, but McHenry County was leading the overdose death toll in 2017 per capita, and like now the death rate in McHenry County has fallen almost by 200%. So it's been a pretty drastic impact, and McHenry County was actually the only collar county to not see an uptick in overdose deaths during COVID-19. And I think that like attributes a lot to a lot of the community-based services that were implemented by not only New Directions, but there's some harm reduction agencies that were also funded by the Mental Health Board, and just the community being willing to engage in the fostering of the programs. So that being, yeah.
Okay, my other question for you is related to outcomes, and you mentioned a bit about reducing overdose deaths.
Yeah.
But in terms of recovery, for example, from opioids or from alcoholism, and I mean, who you mentioned that you really don't rely on 708 board funding anymore. So I'm sort of interested in it. Who are you responsible to or accountable to for outcomes?
Well, so we do currently have 708 board funding. We've just been able to reduce the funding over the years. Yeah. So I think the point that I was trying to illustrate there was just that if it were to be non-existent, our organization would not fall apart at the seams. Right.
Okay.
But as they continue to fund us, right, that continues to allow us to put the money that we're generating into growing and meeting the need in the community. So, but we are responsible to the 708 board in the specifically in regards to the programs that they've funded, right? So the house that they allocated funds for, that's in Crystal Lake, we report outcomes on all the residents of that house on a quarterly basis, and we keep track of the things that we measure are social connectedness, quality life improvement, abstinence, and integration socially. So we've got different mechanisms that we use and our case managers use to capture that data. And then we have agreed upon thresholds that are that must be met with our organization and the mental health board. And our goal is always to exceed those thresholds, and we usually do. But yeah, I don't know, does that answer your question?
Yeah, to a large degree it does. Are the thresholds set by the board?
Well, I think that,
or is it sort of a mutual?
It's a mutual, yeah. The board, I think what the board does a really good job of is on some level they trust the organization to say, hey, listen, this is what we're good at. Like this is, and they don't pretend to know every single thing about every single area of the behavioral health space, right? That would be very difficult to do. So I think they take an objective approach to it, and but yeah, like one of our goals is that, or one of our thresholds is, for example, abstinence, right? So our goal is 60%, right? So 60% of the people who come to our house will achieve at least 3 months of abstinence. So, and we average at 86%, so no matter how many people move through the house, 86% will stay sober for at least 3 months, which is a good number. And that's not a common number in the addiction space, but we're confident in our model and what we do, and we're able to meet that on a regular basis. But the mental health board say, hey, listen, we want you to keep 20 people sober a month for 3 months, 3 times, this, and they don't come up with those metrics. We brought those kind of things that we felt like we could adhere to.
Okay, yeah, that answers my question very nicely. Thank you.
Yeah.
I don't want to monopolize the questions here. Do any of the other board members have questions for Chris? Yeah, Cindy.
Chris, this is Cindy. How did I miss how you raised the $600,000?
So that was just a collaborative grant. So that was 708 board funding, but we had both us and Pioneer Center had both come to the table with $600,000 raised in capital, and the 675 kind of bridged the gap there. So, okay. But that was a significant project. So not something like that hasn't really happened in a while. It's the type of big, sweeping community project.
Okay. Anyone else?
I have one. Thank you so much for joining us, by the way. We appreciate your time. I just wanted to ask you, have any surrounding villages or cities reached out to maybe do a collaboration or do, like, for example, is this help just for McHenry County residents, or if someone from Elgin?
No.
Okay.
So we have one house, right, that we have a priority list for McHenry County residents, right? Okay. So and that's just because that house was purchased with McHenry County property tax dollars. So
got it.
I mean, but on average, to give you an example, we have a wait list right now of 77 people to get into our houses, and on about 40% of those people are McHenry County residents, but the other 60% are often from Kane, DuPage, Will, Cook, whatever. We've got a relationship with the Kane County Sheriff's Office and how to, leverage the Way Out program and be an available resource to them. But yeah, by no means do we only serve McHenry County. There's no stipulations on that. And even if we had a bed that was available and there wasn't somebody available from McHenry County to move into that home, we would fill that bed. It would not remain vacant. And that's a general understanding that we have. And it's kind of one of the conditions that was put on the house when we purchased it.
Awesome. Thank you so much.
Anyone else? Well, Chris, it doesn't look like we have any other questions. I want to, again, thank you for joining us tonight. It's been good to learn about what you're doing up there in McHenry County and the approaches you've taken, and congratulate you on the successes that you've had so far.
Yeah.
And we look forward to, maybe having some ongoing conversations with you in the future as we get better organized here.
Oh, yes.
Yeah, I just, I'd like to just say, I would, the relationship that we've created with the 708 board has really been able to serve a lot of people and definitely has directly affected many lives. And so if there's an opportunity for, our organization, either of our organizations to be involved, with the Dundee, is it Dundee Township?
Dundee Township, yeah.
Yeah, 708 board on some level. I mean, we'd be very interested in that. And if you ever need anything, please don't hesitate to reach out. I would love to help in any way that I could.
Our board might have to take a field trip.
Yeah, that would be wonderful.
Yeah, that would be
Yay.
good.
That would
Yeah,
be wonderful. Yeah.
I would be happy to do that. So at any given moment, if you want to put some dates together, we could spend, an evening looking at all the houses, the new project in Woodstock, and touring the treatment center, taking a look at all that. I'd be happy to show you.
Great. Okay, well, again, thanks, Chris.
Yeah, thank you.
You're free to stay on for the rest of the
As
board
much as I
meeting.
love 708 board meetings, I will jump off.
Thank you.
All right, thank you so much. Bye.
Bye. Well, I did want to give him the option. Okay, any other comments on what Chris had to say?
I did not know that those resources were available so close. I mean, if you think about it, McHenry is like our neighborhood, like our neighbor county. So I think it's great to know that he's available and he's willingly sharing his contact information with us, but also that he's so close, so it's great.
At the same time, I'm not sure if he clarified whether the admission of McHenry County patients is a higher priority than Kane, because it seems like, most of the space would be taken up by McHenry County residents, and I'm not sure.
I can answer part of that. My experience with the Bloomingdale Township 708 board is that we have to be very specific of where we're spending that money. It can only be used for Bloomingdale Township residents, and we have to keep addresses, and none of the monies that the 708 board allocate can be used for people outside of the township. So I am guessing that they have very specific numbers of beds. For instance, we have 8 treatment spots open at I think it was Amita. that are specifically for Bloomingdale Township. Nobody else can access those spaces. So we also have reduced cost medication, again, only for Bloomingdale Township residents in that program.
If we are able to do that on that level with Dundee Township residents, then I think it would be overall worthwhile, but I'm a bit conflicted personally.
You start where you are, and
Yeah.
when we can get any type of service on the ground, and then build from there. DuPage County is looking at expanding the 708 boards county-wide. So it started with a handful of 708 boards, and in another rotation or two, they're looking at doing what McHenry County did. So there will be a referendum in DuPage County to make the 708 monies county-wide, so that the richer places like Bloomingdale, and I'll tell you, Bloomingdale is one of the richer property tax areas, will not exclude, that we'll be able to spread out to some of the poor parts of DuPage County if we go county-wide, but that's down the road. Bloomingdale Township is just starting. So start where we are. Where we have our funding right now is the Dundee Township property taxes, and we'll start there, and we can go far, but I mean, we have to start with dedicating that to the people in Dundee Township. Did that answer a little bit of your concern? We can't.
More or less, I guess.
It
Yeah,
would
I
be
think-
nice if we had socialized medicine, but not yet.
I mean, if we could ensure a specific number of beds for residents, say even just 1 or 2 when it comes to this housing, I think that would be worthwhile. But if it's non-guaranteed, it doesn't really seem.
Well, I think the thing to understand, Alec, is we couldn't fund a bed in McHenry County. The money has to stay.
Yeah.
within-
Okay.
the money
Okay.
has to stay within the township. I think that was.
Okay. Oh, yeah. Okay. That
Oh,
makes.
thank you.
more
Thank you for that clarification.
Yeah. That clarified. Okay. I was just a bit.
Yeah, I think, one of the takeaways from Chris is he describes some of the programs that, he's been involved in helping to put together or getting the resources to put those together in McHenry County. And I thought it would be interesting to hear what they've done up there.
Oh, okay.
And then,
Yeah.
this was more of like educating us to what some of the other areas are doing. Now he uses, based on my understanding of what he said tonight, he's using a hybrid funding model.
Yeah.
He's not 100% reliant on the 708 board. He goes to the 708 board for some funding. They raise funding through other means. He didn't get into how he does that, but, and then he mentioned that he's got a relationship with the Kane County Sheriff's Office. And Sheriff Hain, I know, is very big on keeping, that he doesn't believe that people who have drug addiction problems deserve to, be in jail necessarily if they're willing to, try to overcome their addiction. So I know, Sheriff Hain has been reaching out and trying to develop, backstop programs to keep people out of jail and on the road to recovery. That was probably one of his better options in the northern part of Kane County, is my guess.
My apologies. I thought we were under the consideration of associating with them as an organization. So I was just very confused.
Oh, no worries.
Oh, but as to that type of hybrid model, I am very open to that specifically. I think that could be quite beneficial. I was just more confused about the context of whether or not we were adhering to that specific organization
Oh, no, it was,
directly, because I was, okay,
No,
my apologies.
Yeah, no, that's okay, Alec. I think, we're at the point now where, I think we're at, trying to educate ourselves because we all bring different life experiences to the table here. Just to educate ourselves about other things that are going on around us. I think the other, we will have to begin to focus here in the not too distant future on what we think our priorities are. And then we'll begin to entertain, proposals in a formal sense from people and organizations who wish to provide services to support our priorities or the township's priorities for supporting mental health and homelessness and addictions, et cetera. So this is more of education. I wouldn't look at this like as a pitch to provide services in Dundee Township or anything like that. It's just a set of services that, Chris has, been involved in McHenry County, and it's an interesting one, which I think, judging from this discussion, I think everybody felt was valuable for him to come and talk to us tonight.
Oh yeah, well, having some background experience with McHenry County and some health services there before, I can say I was pretty impressed with the organization and the idea of the sober cafe.
Mm-hmm.
Just personally, I think, I remember being a teen, I remember being bored and, the go-to would
go to
be,
bars anyway.
huh?
Being a teen, you couldn't go to bars anyway.
Well, I mean, I'm going to seal my lips, but let's just say, what is the saying? Idle hands are the devil's plaything. So
Yeah, something like that. Yeah.
I think having a place where people could just actually keep themselves active, because I know for sure when it came to my friends and recreational substance usage, if we had something more active to do, more I guess stimulating psychologically, and we had the access to that provided by the community, I think we probably would have chosen that, realistically speaking.
Okay.
So.
All right. Okay, what I'd like to do, if nobody has any objections, is I'd like to move the conversation back onto the agenda. We were talking about SharePoint. I think, Cindy, we know we still got some issues there with you. Is everyone else pretty well set with SharePoint at this point?
I have to try and work with him.
Oh,
Go ahead.
I currently don't have access, but I am trying the password reset option that I spoke with you at the beginning. So I'm gonna try that. If I continue to have issues, I'll just shoot you an email and see where we can go from there.
Okay. Wendy?
Yeah, I was going to say I'm having issues with it too. I'm going to spend some time tomorrow trying to figure some of that out.
Okay. Okay. And then let's move on to the next item, which is status of interviews. Has anybody had an opportunity over the last couple of weeks to have any further conversations with people? Honestly, I have not. So,
I did, but It's been a while.
Okay,
It was an informal interview with my current principal, who is in the process of getting another position like mine to the school, so having 2 parent outreach coordinators. I want to say that our conversation geared a lot towards families who are experiencing like financial situations, domestic abuse as a result of COVID. And now that we are making phone calls to our families and making those surveys to know if classes should continue the virtual setting or not, parents are starting to share with us that there are bigger conversations regarding mental health resources that, and resources that could be available through schools that are very much needed right now. So I just feel like my principal and I had a very engaging conversations. And when I keep talking to parents, it just keeps bringing up, like, I've had several parents cry with me over the phone, just saying, I don't know what I'm gonna do. I don't know how I'm going to feed my children. I'm stressing out. I don't see the light at the end of the tunnel. And these are families who are who were already like low income families. So with the impact of COVID, it's just making it worse. So I think, I don't want to be pessimistic, but I think the situation with COVID has really impacted like our mental health resources and access to them. So I think I just wanted to make that note, because now that I'm working directly with parents, it seems like there's a bigger need for it, and parents are really, really feeling the pressure of not knowing how to navigate, the virtual setting and supporting their kids and things like that. So
okay.
I kind of wanted to
I
say
have
the
a
same
question.
thing. I haven't had any formal interviews with clergy in the area this past month, but I've had a lot of informal conversations with folks. And as many of you probably know, October is Domestic Violence Awareness Month. And I am hearing really heartbreaking stories of the increase in domestic violence in our area. And it's born out of exactly what Maria was talking about: high stress levels, don't see a light at the end of the tunnel, feeling cooped up with each other, kids not going back to school, so the parents not getting that emotional, mental relief in the middle of the day or during the day. So, and to couple it back to the previous conversation, drug and alcohol use is up too. And that always leads to increases in domestic violence. So just hearing a lot of those, having a lot of those kind of conversations, even if not formal interviews with folks.
Okay. Any other comments, questions?
Yeah, Maria, how is like specifically, I'm curious as to how mental health issues have manifested within children.
chronic absenteeism will be the most common. For example, our truancy levels are way up high compared to previous years. I mean, districts who had high number of chronic absent students are now seeing like double the numbers or triple the numbers, because again, it goes back to like the cycle, like low socioeconomic status, then lack of resources, no internet, no food, children tired, family struggling. Who has time to connect? Who has the resources to connect to their virtual classes? So I think that's the first thing. The first important sign that we see is students who are chronically absent, like 2-3 weeks of not showing up for school. And if they do show up, they're falling asleep or they're not engaged. And I think I wanted to share that with you guys too. In our last meeting, I wasn't able to make it, but teachers are reporting that students are literally like this, like they don't answer. Like it's like they're blank. Their mind is blank. They might have a teacher in front of them teaching them, but they're just blank. They don't engage. They are not asking questions. And obviously educators feel those pressures too. So I'm not saying at all that, you know, there's blame on anybody, like, but it's just children are just becoming these kind of emotionless.
Yeah. Zombies, low affect.
Yes. One of our teachers was just so shocked that that was their first week of school. She had like no questions from kids. Like she would just try to keep them engaged, and they just had this blank face. So I feel like on motivation, like class refusal, absenteeism, it manifests in different ways, but it's just so, it's really heartbreaking to have conversations with educators about, you know, our current situation. But I think we're all trying our best. You know, teachers are trying their best, and it's not an ideal situation, but we just kind of have to understand that we're all going through that. Children, you know, adults, seniors, everybody's kind of experiencing the same thing. So, yeah.
Yeah. I guess it's hard being a parent and trying to keep your kid in line when you're kind of on edge yourself. It kind of gets to a very weird gray area, which has been a bit depressing. But I mean, is there a legal way, say, people are able to interfere and take action when it comes to this abuse or truancy or these issues? You know, I mean,
Yeah, we have different supports, like for example, home visits. We offer, you know, food pantries. We offer breakfast. There are many things there are many interventions that we can offer. But at the end of the day, families who are suffering and who are experiencing a, you know, job loss, or even we've had families that have experienced family deaths through COVID, that it doesn't matter how much schools try to help. You know, at the end of the day, this is a worldwide national pandemic crisis, you know, so it's just a very difficult moment for everybody.
oh, I agree, but I mean, I know,
Alec?
of course, there's.
Alec?
Sorry,
I-
I'm going on a tangent.
Yeah.
You're reeling me in. Thank
Yeah,
you.
I am.
I'll be quiet. Thank you. Sorry.
I'd like, the next two items on the old business are develop a budget, which we're not ready to do yet, and develop 1 and 3 year plans, which we're not quite ready to do yet. So I'd like to table those for the next meeting and move on to the update on ACMI, or I think is how you pronounce it.
Yeah.
They have accepted our application for membership, and I had a discussion with the executive director today to talk about, you know, where they could, or the organization in general could be beneficial to us. One area that is pretty clear, and we didn't really, I mean, we're not going to talk, we didn't talk about it all that much, but is that they are really, part of what they do is lobby, you know, lobby elected officials for the benefit of 708 boards and the other boards that are associated with them. And as an example of one of their successes she gave me was, and I don't remember what year it was, I think it was fairly recent, was there was a movement to allocate 20% of 708 board budgets to county sheriff offices. Just off the top, just 20% goes right to the sheriff's office, and they successfully fought that. with the legislature. So that died a death, which is beneficial for the 708 boards for sure. But one of the things, they have a fair number of members, a fairly large number of members. And it's an organization that's built on sharing experiences, sharing documents, such as contracts and those types of things. And apparently they have a library where they collect these things. And if we were to ask them for an example of something, if they don't have it, they usually put a call out, or they will put a call out to the rest of the membership to see if anyone has something similar. So I think that's I put that in the category of, you don't have to invent things from scratch category, which is very beneficial and should help us, propel us forward, rather than doing a whole lot of groundwork. We can actually have, build on a foundation that's been put together by others in the state. And the other thing she mentioned, and I know she's already done this, although I haven't had a chance to follow up on it, was the 708 boards in the southern part of Kane County have, for lack of a better term, an umbrella organization that they sort of all belong to. It's not sharing funds or anything, because each of the boards is separate, but sort of I guess a formal way of sharing information or keeping in touch with one another. I don't really know all that much about it, but Eileen Durkin, who's the executive director of ACMI, did an introduction for me today to a person in that organization. So I'll follow up on that and report back to the board on what that's about as well. So that's moving along. So I'll have more information as I dig into this. Today was the first day we were able to connect since they accepted our application. So that's about all I have to report on that. But we'll be hearing more about this in the future, I'm sure. And Dawn, I think you've had some experience with them as well.
Correct. I've gone to some of their meetings, and they are very generous about offering templates and support and ideas and connections.
So I think it'll be pretty beneficial to us.
I agree.
So are there any questions about that?
Is there an online, I guess, medium to connect to ACME?
They do have a website.
Yeah.
There isn't
Okay.
a whole lot. There isn't a whole lot of information out there. I'll send out the website link to everybody.
Okay. Thank you.
Let me just make a note of that, so I don't forget it. Yeah, and you can go look at what they have there. There isn't a whole lot. Eileen told me today that they're one of their things to do is to update the website and upgrade it and stuff like that. So, so I'd like to move on to new business. Potential speakers, if there's anybody who has someone who they feel it would be good for us to talk to. I didn't put the folder out on SharePoint yet, but then again, we're still having some issues around that. But if you have suggestions for speakers, why don't you just send them to me directly, and I'll collate all that stuff for the time being.
Why not just clarify really quick, these potential speakers don't have to necessarily have a connection with other 708 boards, right? They can speak on issues regarding mental health. And like, do they have to have any certain connection to?
No.
Okay.
No, if you look at it from the perspective of educating us.
Awesome. Yeah.
I think that, that I think the bottom line is what we're interested in at this point, not necessarily organizations that have, relationships with other 708 boards or anything like that. Although as you saw tonight, that's fine too. Okay, yeah, and also the speakers should, you know, address what we're responsible for, you know, according to the legislation, mental health, addiction, those types of things.
Great. So I'm gonna put on the notes that if we have any potential names to send them to your email, is that okay?
Yeah,
For
that's
now?
fine.
Okay.
Yeah, send them to me directly, or they can send it to everybody, the 708 board, you know, general email address, either one,
Sounds good.
okay? And then I would like to spend a little bit of time about the documents that Dawn was nice enough to provide from Bloomingdale Township. Their one-year plan, their three-year plan, and also their bylaws. I was a little bit surprised about the bylaws. That never even crossed my mind that that was something we might want to do, and I'll talk to Trish about that. My sense of reading the bylaws is, for the most part, they've taken sections of the legislation and incorporated it into their bylaws with some other additions to it. But I don't know if anybody had a chance to go through all of those. My major focus really is really on the 1 and 3 year plans at this point, unless you disagree, because this is something we have to. We're legally obligated to create and to inform the board, the Dundee Township board, and the supervisor what our 1 and 3 year plans are. And so I would be interested in people's reaction. Let's start with the 1 year plan. You know, what people's reaction to that was. Anybody?
This template was borrowed from some of the other 708 boards, and it's fairly straightforward that we have to establish a budget and then open a grant process and review the grants. And just last night, I went through the entire grant process with Bloomingdale Township, and the board went through all of the grantees and decided how much to award each grantee, and it went very fast compared to the first year. The first year, they were there really, really late. It took like 5 or 6 hours, and there was a lot of discussion. Last night, it went fairly quickly, and it was only 2.5 hours. But they go through each grant and decide how much they will award each grantee, and or if they have other discussion that they need from each grantee. So for instance, there is one group that I really, really like. It was the senior daycare grant from Trinity Lutheran Church. And unfortunately, they had to close down for all of COVID. Their grant monies from 2019 to 20, they will hold on to. They have an 18-month cap to use the monies that we had already given them. So although they didn't apply for a grant for 2021, they have grant money from a year ago, and then they will reapply for another grant. It's a great program. It's mostly Alzheimer's and dementia township people, and there's some scholarships. So we have to establish our budget, our grant, open up a grant situation, develop the forms for the grant, and then develop, when the grants are done, close the grant process, and then we have to review the grants in a meeting and decide how much money we're going to allocate to each group. This year, the number of grants was small. There's 2 or 3 groups that did not apply for a grant because they cannot operate during COVID. There were some new grants that expanded. They collaborated. There's 2 or 3 groups that are collaborating on early childhood intervention, which is really neat. So the YWCA, the March of Dimes, and another group collaborated on executive function testing for the 0 to 3 group. So that would be under our 3-year plan, but the 1-year plan is we have to start this whole process, and this first year is a lot of work.
Yeah. So, for example, the goal 1 there is to open the grant process. That's what you're
Yes.
referring to, right? Okay. I mean, when I read the 1-year plan, it seemed pretty reasonable to me, and how, you know, how to get stuff started off. And I think we could use it as a starting off point for our 1-year plan as well. And I'll see if I can. I'll ask Eileen for some other 1-year plans, beginning 1-year plans from the early days of some other 708 boards, to see how they approached it as well. Although I suspect it's
I was
probably
just
not
gonna suggest that, to maybe get in contact with that lady from the association,
Yeah.
and maybe do neighboring. Well, if they have they have from all over the states, right? It's a
Right.
national. Okay,
Yeah.
yeah. Well, or maybe counties with similar population to ours or demographics.
Or townships, yes.
Yeah, and I did talk to Eileen a little bit about the size of the township and what our potential budget could be for the coming fiscal year as well. And she actually started pulling up some stuff while we were on the phone, and then said, well, yeah, let me look into this a little bit more. So yeah, I think that's a great suggestion, Maria. Because I think having organizations that are similar to ours, that are similar in size in terms of the township, in terms of budget, I think is
Population, yeah.
population and budget. Because you could, and which aren't necessarily tightly linked in some of the counties in Illinois. So in my discussions with Trish, and she's obviously not here tonight, but when, and the legislation isn't clear on this either, when you have to have the plan put in place, but I think sooner rather than later is to our benefit. Particularly when what we want to do is present it to the township board, which is an informational thing. It's not something for their approval. But I think it helps us a lot if we can be transparent and knowledgeable about how we see the next year, how we would like to see the next year roll out, I guess is what I'm trying to say. Does that make sense to people?
Do we have to turn in both at the same time, like the 1 and 3 year, or does one kind of like guide the other one?
I don't know.
Yeah, there is no clear answer to that, Maria, because if you look at the wording in the legislation, it just says you have to do these things. It doesn't say when you have to do them.
Oh, okay.
One of the things that we will have to take a look at is the calendar, because any monies that we appropriate or that we decide to levy, Bloomingdale wanted to disperse that following January. So we got the levy in June or July. We did the grant process, and which made for a really busy fall, and then awarded the grant recipients, and the money started going out January 1st of the following year. So the levy came in June or July, the monies, and the township, who is the fiscal agent for that, set up all of the bookkeeping and the how to bill the township through the grant. And then money started flowing out January 1st. So between June of next year and December of next year, we have a lot of work to do. The calendar for Bloomingdale 708 board, they had meetings every week during September for the grant review process, and it accumulated in the meeting we had last night. So it was a lot of time by the board members. So heads up, Pete, we're going to have to do that.
Yeah, so the way, so Bob, correct me if I'm wrong, but I believe the township fiscal year begins March 1st.
Yes, that's correct.
And the money actually flows into the bank accounts in June or early July.
Basically, with Kane County, you get 6 to 7 disbursements of the property tax money during the year. The first one comes in May. It's relatively small. You get your largest one in June, and then some in July, August, and then the next big one is in September. So your two biggest receipt months are June and September. So figure you get about half May and June, and then the other half in September.
Yeah, okay.
And your levy typically will have to be sent into Kane County by the last Tuesday in December. So
Yeah.
So you have to prepare what you want to see come in taxes by the end of December, get that down to county, and then you can always rebate. So if, let's say, you ask for the full amount, you get through June and you've got half the money, and then you choose not to, or you figure out you don't need the whole bit, you can rebate the taxes accordingly to the taxpayers.
Yeah.
Say again when we have to file the levy in December.
Usually it's the last Tuesday of the year.
Okay, last Tuesday.
Right.
So
Last Tuesday.
Yeah, so what Trish has asked us to do is have our budget, which is essentially the levy, ready for presentation to the township board at their December meeting, which is the second Wednesday, Bob?
third, it would be the 16th of December.
Of December, right, which is prior to when the county requires the filing.
Exactly.
Yeah, so that's what we're working towards. So I'm hoping we'll make substantial progress on that in November. I think what we'll do is, I think we'll be in good enough shape, at least at a high level, to understand what to get some sense or agreement on what our priorities are. And if you look at the one-year plan, it's fairly general. I think we can certainly come up with something that's similar to that. And then present our levy that we want to file with the county. And so we have the November meeting to really start to dig into what we want to do. And then we have the December meeting, which occurs before the December 16th meeting, because we meet on the second Thursday of every month, to do any final work on what we want as a budget and our priorities. So at least we can, justify what we think we want to do going forward. And as Trish has noted earlier, and as Bob explains, when the money comes in, there's a gap between when the fiscal year starts and when the money for us would become available. And Trish said that if there were things that we wanted to do, didn't require substantial sums of money, that we could borrow that money from the township. I have a sense that we won't be in a position for that, but you never know.
Yeah, and certainly if it's a large amount, just to be fair, I think you'd have to approach a bank like First American, for example, to give you a revenue anticipation loan. Because I don't know if the township's going to be in position to fund a large scale project for you.
No, and I don't think we'll be ready to even move ahead with a large scale project at the beginning, in the early.
I would think not, but just in case.
Yeah, no, I appreciate the comment, Bob. That's great. Thank you. So the next meeting is really a roll up your sleeves meeting, which is why I'd like, for those of you who have any, summaries of your discussions with people that you can, I know I have Maria's, I have Alex, mine are up there, but Dawn and, and I know Cindy has hers. I've just got to figure out how to get them to me at this point. So, because I'm more than happy to go through all of those and extract some of the themes and collate those in terms of what we see as potential needs. And then we can have a discussion around that and try to nail those down in the next meeting. And then I think we'll be on the road to at least get a budget out there, and then start, as Dawn indicated, start to roll up our sleeves and really focus on putting a process in place for receiving grants, how we're going to evaluate them, et cetera, going forward. And I would see, if things really work out well for us, to maybe start accepting grant proposals maybe in the second half of the year. I think is probably a reasonable timeline. I mean, we got a lot of work to do. We all have other responsibilities as well. So trying to balance all that and come up with a realistic timeline, but that's sort of the timeline I've come up with at the moment. And it does make it more difficult that we're doing this remotely. I think this would be a whole lot easier if we were all meeting in the same room. But it is what it is right now. So we just have to deal with that. But if you have, you don't need to reserve your comments for just this meeting as well. I mean, feel free to, take some time and go through the documents and compose an email and send it out to everybody about what you're thinking about. We can do some of that, in a sort of asynchronous mode. And then when we get together in November, let's roll up our sleeves and start to, put pencil to paper, I guess. Does that make sense to people? Is that timeline reasonable?
Do we need to meet in October again?
I don't, I don't know. I mean,
No? Okay.
I don't think we do. I think, if we can do just a little, carve out some time to go through the documents and maybe produce some comments and get them out there in front of everybody, maybe have some asynchronous conversations going on. And then, come ready at the November meeting to, really start to put some structure around what we're trying to do here. Wendy, does that sound reasonable to you?
Sorry, yeah, I've got him muted. Yeah.
Okay. Everyone else, Alec, does that sound reasonable?
Yeah.
Okay.
Yes.
Okay, great.
Thank you for all the back work you've been doing, Paul, because I just don't have the time.
Sometimes, I mean,
Definitely agree though. If we were in person, we can create like a little, model. We can use like a whiteboard marker. I'm very visual, so I like to like brainstorm ideas that way. And it's just sometimes when you have to type conversations that you've had with people, it's just like it kind of all the essence of it kind of goes away. But I mean, it's important that we do have those priorities and like a good understanding, clear understanding. What is it that we want to prioritize? So.
Yeah, the other thing that Eileen and I discussed today was that when the budget becomes public, that the phone will start ringing off the hook for all, for everyone who wants to don't take it a negative way, but a piece of the action, okay? But, basically, feel that they might have services to offer Dundee Township. And I have no doubts about that. That's what's going to happen. What will help us, I think, is that if we know what our priorities are, that if we know we're going to focus in this area, this area, and this area, that people who come to us who are saying, well, I've got these other services for this, and, for X, Y, and Z, we can say, right at the moment, our focus is over here. We appreciate your interest. And if we're transparent about what our priorities are, if we're transparent about what our budget is, it makes it a lot easier to say no to these people. Yes, you'll have an opportunity. Yes, you'll have a potential opportunity later on, but that's not where we are right now. And it gets rid of as much as you can about the politics and, all the, behind the scenes maneuvers that go on for good or for ill or for.
Can you give me an example of that?
I'm sorry?
Can you give me an example of that?
Example of?
Of who might be coming at us with services to offer?
Well, I think people who provide homeless services, who provide services to the mentally ill or the developmentally disabled, there are a lot of service providers around. They don't happen to be in Dundee Township right now, for the most
I was
part.
gonna say, is that because they're gonna be finding out we're a new 708 mental health board?
Yeah.
Okay, all
Yeah.
right.
Yeah, sorry, yes. That we're new,
Okay.
that we're a new 708 board, that we have money. And if they want to expand services or they see a need here, then yeah, they're going to come to us for that. And if at least we know what our priorities are and and we build a process for receiving grants, then it makes our lives just a little bit easier overall, that we're not, having to sort of fend off. So that's my 2 cents on that. Because yeah, word will get out fast. That's for sure. Anything else on the Bloomingdale Township documents at this point? I'll talk with Trish about the bylaws, whether that's, and I'll talk to Eileen about it too, whether that's, and in some ways I can see where they're beneficial, but it's also work to get done as well.
Yes.
Yeah.
So if there are no more comments on the Bloomingdale documents, is there anything else that people would like to discuss? Moving on to agenda item 8. Which is actually after 9.
Where's this recording actually being put again?
The recording, Alec, is available through the Dundee Township website, dundeetownship.org.
Okay.
And if you scroll down just a little bit, about maybe a third of the way down the page, there's a red band that goes across the web page that has links. And one of them is meetings and agendas. If you go to that link, you'll find the meeting and agenda items for Dundee Township, as well as for the Dundee Township 708 Mental Health Board.
Okay. I'm not a narcissist, I promise.
No, that's fine. No, but that's where they are. It's good to know.
Yeah, just
Yeah.
good to keep on top of things to
Yeah.
reference sometimes.
Yeah.
So, thank you.
So that's where they are. It takes a couple days. I guess, Bob, are you going to be responsible for putting this up this time around, or?
Yeah, between I or Trish, depends on how she's feeling.
Yeah, so usually she tries to get it up by the early part of the following week. So we'll, we'll leave it at that, but it'll get up there as soon as soon as everyone's able to get it up there. Anything else for open discussion?
Have we developed the calendar for 2021 or,
No. Thanks for bringing that up. I will put that on the agenda for the next meeting.
I
Dawn?
thought we said we were gonna do it in November, wasn't it?
Yes, we were going to do it in November,
Okay,
which is the next meeting.
yes.
So I'll make sure I get it on the agenda, that I don't forget. So 2021 meetings. Thanks for reminding me, Dawn. Anything else?
Next meeting is,
The next meeting is,
November 12th,
thank you.
Thursday, November 12th. And then the meeting after that is Thursday, December
We'll have
December 10th.
election results by then.
Yeah.
Wow.
December 10th.
Don't bring that up.
And I will,
I'm nauseous as it is.
on the next agenda, I'll make sure that I do post what the next couple meetings are, so you have them written down as well. Anything else?
Vote.
Okay, I'll
Yeah. Vote.
entertain a motion to adjourn.
So move.
Thank you.
Second.
Thank you, Alec. Maria, would you take a roll call, please?
Yes, this is to motion to adjourn the meeting. Trustee Don Arimura,
Aye.
Trustee Maria Borrero, yes. Supervisor Trish Glees, Trustee Alec Neuschaefer,
Aye.
Trustee Cindy Oldin,
Yes.
Trustee Paul Setze,
Yes.
Trustee Wendy Witt.
Yes.
We have 6 yes, 0 no's.
Okay, the meeting is adjourned. Bob, would you please stop the recording?
Yes, I will. It is